Welcome back. You're watching Citizen Weekend. Let's get into our conversation of childhood cancer. It is the second leading cause of death in children under the age of 15. Now, that's the global number. We're not so sure of the numbers here in Kenya, but it is quite prevalent. I want to reintroduce my guests. Joining me tonight to my far right is Caroline Kaburu. She is the mother of a wonderful 6-year-old boy, Alex, who survived. We're thankful for that. Also, Sydney Chahonyo, who is the board chair of Hope for Cancer Kids. And we also have Dr. Doreen Mutua, who is a pediatric hematologist and oncologist at Gertrude's Children's Hospital. Thank you all for joining me. Let me start with you, Dr. Mutua. In terms of the kinds of cancers that you see most prevalent in children, what is there?
So the top 5 cancers we see in children, acute leukemias, which are blood cancers, are the most prevalent. Then we have brain tumors. Then we have the lymphomas. Then we have the eye cancers, we call it retinoblastoma. And then we have the kidney tumors, we call them Wilms tumor.
Any reason why the leukemias are so prevalent?
Actually, nothing can explain why they are so prevalent, and this is something that occurs worldwide. It's actually even in other parts of the world. Leukemias are actually the most prevalent cancers in children.
Interesting. And you shared with us earlier, Sydney, that you actually are a cancer survivor. You contracted it when you were 19 years old.
Yes.
What was that experience like, even in terms of the journey of diagnosis, because that tends to be a big problem, a lot of misdiagnosis, late detection many times. But what was your experience like?
In terms of diagnosis, initially I started getting very mild headaches. Very mild headaches, you know, you take a Panadol, you drink water, you sleep it off, you don't think twice about it. At the same time, I started getting flu symptoms, like I would get a runny nose. So, you know, first you don't think about it, then you start taking medicines for it, self-medication, or you go to the pharmacy and get something for it. At the same time, I started nose bleeding. But these all started happening at different times. So I started nose bleeding maybe once in a month, then all the symptoms started getting more and more frequent. And already as a child, I had lost hearing in my left ear. And because of where the cancer was, it was starting to block my hearing on this other side. So that's actually what got me to go to the hospital. Even though there were all these other things that were going on, I didn't really connect them or think there was something more serious. So I started going to hospitals, some of the major hospitals in Kenya. I was treated for sinus issues. Take these medicines, after 2 weeks, come back. I come back after 2 weeks, still nothing has happened. Eventually, I was referred to an ENT. And I went to see him a couple of times, but he only goes to his office on Tuesdays and Thursdays. And the days I was going, he wasn't in his office. So one day I just happened to be there on a Tuesday, and I saw him. And as soon as I told him what was going on, he asked me, "Did you tell the other doctors you saw what you're telling me?" And he's like, "I told them exactly the same thing." And he went and read the report, and even without asking me any more questions, he's like, "I think I know what you have." So luckily, he was able to diagnose me. And for cancer of the postnasal space, they said it had been in the body about 6 months. And for that type of cancer, that was early. There are some cancers, childhood cancers, that double in size within a week.
Wow.
So it all depends on what kind of cancer you have, how aggressive it is, and how your body responds to it.
Right. I mean, Caroline, when you started to see some early signs in your son, what were you noticing?
I'm not sure whether what I saw were early signs, because he suddenly began having stomach aches. They became more frequent with time, very frequent, very intense. We took him to the hospital, put on antibiotics for about 2 weeks. The doctor discharged us because probably they were not able to find where the problem was. The scans would not show anything at that point. We were discharged, we went home. 3 days later, now the stomachache became more intense. The vomiting became more often. Some doctors suspected ulcers, and ulcers at the age of 3.5 years was not really making sense. So with ulcers, I'm told if you take milk, you will not vomit. But he could vomit anything, including water. So we took him to some hospital. again put on antibiotics, but on that evening, after the injection, after the antibiotics, on our way home, at the door, he vomited blood, and I felt this is a bit serious. We didn't even open the house. We were with my mom. We went back to the hospital, to a different hospital. We did not go back to where we were. The doctor admitted us. He saw the pain. Apparently, anytime we would get into a doctor's room, the boy would relax. Then after we have left the doctor's room, at the reception, he would vomit. So, but this time around, it was around 7 at night. The doctor saw the pain. He put him on very strong antibiotics, very strong painkillers. And he said that we starved the child overnight. After all, the boy was starving because he could not eat.
Right.
So we starved the child overnight so that we can do ultrasound in the morning. So before we did the ultrasound, he recommended, he said he needs a pediatrician to advise. So a pediatrician was called. Dr. Mburugo came, checked the child and said, we need to do an ultrasound, an abdominal ultrasound, we need to do a chest x-ray, and also a stomach x-ray.
Right.
So we did the 3 of them. The doctor took some time to try and find out whether there was an issue. The doctors initially, all of them would say there must be a serious blockage in the intestine. So
you found that the scans weren't showing anything.
Yes.
Let's fast forward to the point where surgery had to be an option.
Yes.
And what did they find?
Yes.
After that surgery?
Now, when the ultrasound eventually saw an interception, the surgeon came, did the surgery, and the surgeon opened the stomach with the mind of an interception, only to find a malignancy in the intestine. Actually, there were 3 balls. I saw them in the lab. There were 3 balls inside the intestine, which were blocking anything from going through him. So he advised that we take the samples to the lab, which was tested. In a week's time, we had the results. The results, first of all, came as it's a non-Hodgkin's lymphoma, but we didn't know which one, because non-Hodgkin's lymphoma means it's any other lymphoma apart from Hodgkin's. So again, we had to do immunohistochemistry for us to find which non-Hodgkin's lymphoma.
My goodness.
Yeah, apparently the doctors in Kenya were not able to conclude at which lymphoma it was. The specimen was sent to South Africa. But by that time, the pediatrician had insisted that I move to Kenyatta Hospital. So I went to Kenyatta Hospital. The doctors admitted us, said the results will find us there.
Right.
So by the time the results were coming from South Africa, which confirmed it was Burkitt's, the reason as to why they could not conclude, they say Burkitt's mostly appears on the upper face from the chest moving up, but his was in the intestine. So by the time the results came, we had already started chemo at KNH.
And we'll talk through the treatment process, but let me bring in Dr. Mutua at this point, because I was reading somewhere and I found this very interesting, where they said lifestyle and environmental factors don't play a role when it comes to detecting cancer in children. And for most parents, they're thinking, I would like to know if there's anything that I need to avoid, what is it? But really, there isn't anything you can do. So what are some of the signs or even symptoms that maybe parents should really be paying attention to, if at all?
So, as you rightly said, there are no specific symptoms that cancers will present. And that's why it takes sometimes so long to establish a diagnosis. So some of the early warning signs, we call them early warning signs that patients should see, and actually even healthcare, because most of these parents are actually seeking help, but the healthcare providers don't recognize there's something beyond what meets the eye. So having like persistent vomiting that just goes on and it's not resolving. Having headaches for the brain tumors that are always early in the morning and associated with vomiting. These anemias, a lot of our leukemias present with anemia that is not resolving. Fevers, recurrent infections, that should prompt somebody. And a lot of the tumors we get in the abdomen actually having a mass. And most of the time it's the parents who come and say, I think I felt something in my baby's tummy. Would you feel it? So if you get that, then have a quick index, high index of suspicion, and send this patient or the parents to a good facility where they can get some basic screening tests which can be able to tell us where we are headed and whether we should do more in terms of diagnostics.
You know, Sydney, you'd mentioned at a point in your journey, you self-medicated, you know, and
Yes.
I feel at times, Kenyans, self-medication can be our undoing. But the reason why a lot of people do it is because they can't afford to actually go into a hospital to get the necessary treatment or further tests, for instance. But Hope for Cancer Kids is trying to at least bridge that gap for low-income families so they can get access. Tell us more about what your organization is doing.
Basically, Hope for Cancer Kids was started as a support group for parents who had kids at actually Ward 1E at Kenyatta Hospital. So initially it started as a support group because they felt they had needs. They needed, you know, counseling, just to talk to someone who's going through the same thing. There were certain things they wanted to push for, but as a group they would have more influence. So that's why they decided to form it. But it wasn't incorporated until 2008. It was registered under the Civil Societies Act. So our flagship program, we find children from less privileged families. We get referrals from county health officials, from nurses in 6 different public hospitals around the country. And then they identify children who have been diagnosed, but they cannot afford the treatment, they cannot afford the tests, they can't even afford the 500 shillings a month for NHIF. So what we do is we raise funds to support these kids by paying for NHIF, and then the government then covers most of the treatment, most of the chemotherapy, radiotherapy, and the other treatment that they need. That's the main thing we do. We also are involved in advocacy, creating awareness, and that kind of thing.
I'm seeing a comment here from Jomo on our SMS line saying, cancer is our worst nightmare owing to the fact that its treatment costs an arm and a leg, yet this scourge is treated so casually. I mean, which brings us into the cost issue, cost factor for you, Caroline. And I think that's what scares a lot of people when they hear cancer. Beyond the fact that this is a life-threatening disease, you're thinking, how much is it going to cost? For you, when you started treatment, the chemo now for Alex, what were you looking at in terms of hospital bills and treatment costs?
The procedure is very, very expensive. That's a fact.
Yeah.
But I'm a beneficiary of Hope for Cancer Kids. They used to pay my NHIF promptly. Though at the beginning I used to pay it. I remember when I was admitted at KNH, my NHIF was in arrears. I could not get admitted. I had to pay the penalties for me to get admission. So at that point, the sickness was weighing on me. I could not even consider finances. Finances was not a priority at that time. So at KNH, if you have NHIF, you can get to the wards. Once you're in the ward, you can get treated. You will talk about money after treatment. At least that's a kudos for KNH, because you get treated first. Then once you're treated, they are done treating you. They are willing to discharge you. That is when they ask for money. So I went to Kenyatta. One of the biggest challenges is with chemotherapy, the drugs may not be available, and especially in a public hospital. But so you keep buying. And again, with chemotherapy, you skip 1 week, the cancer cells multiply. You skip another week, especially during induction.
So you
which
have
is
to be
very
consistent.
Yes,
yeah.
You have to be very, very consistent. But somehow I managed.
And how long did the treatment last for him?
He started in October 2015. Induction took him 6 weeks, that is 6 courses. Then 2 courses of consolidation, day 1 and day 8, those were 4 weeks. Then maintenance, 24 courses monthly, that took me 24 months. It took me more than 24 months because of the 100 days doctor strike, you remember? I had to break. Because again, I could not, at that point, I could not afford a different hospital. And again, with chemotherapy, Daktari will ratify that. Different hospitals have different regimens. So the combination we have at KNH is not what is at Texas. So even if you go to another hospital and change, you're likely to have to repeat. So it took me around 30 months to finish, not 24 months. But lucky enough, he completed his 24th course of maintenance in August, We did intensive checkups. We did an ultrasound. We did a CT scan of his stomach to check whether the malignancy is cleared completely. We did it in May. In July, actually, everything is clear. We did blood counts, the cytology, we call it cytology, the one for the back. Yeah, there's some water that is removed from the backbone. We checked that one. The bone marrow was also extracted. It was clear, and he's doing good. I
mean, it's amazing. And you know, when you walk through this journey, you become an expert almost in a lot of this medical terminology, you know. And I'll come to you when it comes to even the emotional journey, taking him through just at 3.5 years old. You know, this child is not understanding, why am I having to go to the hospital in and out? It's a painful journey as well. But Dr. Mutua, when it comes to a lot of the parents that you do deal with and come across, in Caroline's story, you know, mentioning that it was tough for the surgeon to even break the news, how would you recommend medical practitioners to walk parents through this journey when they're first hit with this news that your child is dealing with a life-threatening disease?
That's a fantastic question. And whenever parents, most of them are shocked that this is really cancer. And you know, most of the parents have big dreams for their children. No one ever sees their child dying early. So the first thing they are is they are shocked, they're in denial, and you need to acknowledge that, but also to give them the truth, and in a very sensitive way. But at the end of it, you must give them hope. And that's why I actually am very proud to sit with these people here who have survived having a child with cancer and even being a cancer survivor. Because the first thing parents say, will this child live? And they just want to hear that there's something you can do, and we can do a lot. So giving that message of hope, yes, we are giving devastating news, but that message of hope must always come at the end.
And you know, let me bring you in, Sydney, when it comes to the kind of support that is required to really tackle, even in terms of research, to understand childhood cancers a bit better, what is necessary here in Kenya to really understand this disease?
I think the first thing we need to do is a lot of research, because there's not a lot of data out there, no consolidated data. There's no, now the government is starting to see the need to establish cancer registries, a national cancer registry that, you know, all the data is put together. And from there we can be able to see in Kenya, these are the cancers that affect us, these are the causes, these are the effects, these are the things that lead to or have been linked to these types of cancers, so that we can now delve more into that research and find out how is this virus, for example, human papilloma virus, how is it causing the cancer. So right now there's not much research, especially on childhood cancer in this country. So I think that would be the first step into understanding this disease. And then from there, I think in terms of support, just setting up cancer centers around the country, because most children are referred to Kenyatta Hospital. We deal with about 6 public hospitals, but I think there need to be more centers so that hospitals like Kenyatta are not overwhelmed. So you set up centers and diagnostic centers as well, because you find a lot of people don't have pathologists in-house, especially in the rural areas. There are no pathologists and there's no imaging service. So how are you going to diagnose that child without being able to do those tests? So by the time you're saying, okay, I don't know what it is, go to Kenyatta Hospital, it's usually too late.
I'm seeing 2 linked questions here, and I'll put them to you, Dr. Mutua. One here saying, this is from Raphael, cancer of the liver or carcinoma is aggravated by a heavy intake of ethanol, which turns cirrhosis, I hope I said that right, to hepatitis B. Most milk factories in Kenya do package milk that is adulterated by hydrogen peroxide. This is why we do manufacture our own cancer. And another question here from Winnie, who says, does cow milk cause leukemia in children below 1 year? So making that link between milk and cancer in children, what do you say about that?
So a lot of myths are out there that many things cause cancer. But what we can tell you for a fact is, other than some infectious diseases and some genetic syndromes, we really don't know what causes those cancers in children. And that's a very key message, because then parents get this idea that, oh, I took coffee, I took too much tea, I took milk, and that's why my baby has cancer. And really, that's not true. And for us to be able to put that statement with the soundness it needs. It needs really good research and data to be able to actually say for sure there's a linkage between these two. So for real, there is no causation between milk and leukemia. And then there was a question about liver cancer and cirrhosis that happens because of taking a lot of alcohol, and that we are not seeing a lot in children because children really don't take alcohol. But in older people, adults, they tend to have liver cancer because of mainly hepatitis B and also because of the cirrhosis that comes because of alcoholic injury. For the liver cancer we see in children, it's called hepatoblastoma, but tends to really be associated with genetic syndromes, and it's also quite rare. So what they're talking about in terms of liver cancer is something we see in adults and not children.
And not children.
Yes.
Okay. Really quickly here, Sydney, someone is asking how can they get in contact with Hope for Cancer Kids?
Hope for Cancer Kids, you can reach us. We have a website. You can log on to our website and you'll find our details there. Our number, our email address, we're on WhatsApp, we're on Facebook, we are on Twitter. So you can find all our handles on our website. That is www.hopeforcancerkids.com.
Okay, great. Let me finish with you, Caroline. In terms of walking this journey, you're on the other side of a bad situation.
Yes.
You triumphed. And for parents watching who they've just found out or they're in the middle of this, how would you advise them to walk their child through this journey?
Number one, you have to be very strong as a parent, because if you keep crying every day, your child has never seen your tears, but now that they're sick, they see you cry, they will give up. So you have to be very strong for them, very, very strong. Number two, you need to pray hard. You need to really pray hard. Personally, I had to really, really pray hard. I had to look for a church. I had to tell some pastor, you have to pray for me. And surely he really, really prayed for me where I fellowship at Jesus Celebration Center in Thika. And for the parents, if you're not strong from the word go, if you listen to the myths, if you listen to you see, we Kenyans know cancer is a death sentence. Like personally, where I come from, people know if you get to KNH, you can only come back in a coffin. But at least my son has proved them wrong. And my son was, I think he's one of the strongest. With chemotherapy, the way kids are dull, they go quiet, low appetite, he responded the other way around. He's very healthy, I don't know how to put it, but you have to be really strong as a parent, as a caregiver, because there is hope. Right. You don't listen to the fact that we Kenyans believe, or rather, probably we believe if you have cancer, you have to die. No. People have survived. Alex has survived. Sydney, many have survived. Right. I found many at KNH who survived, who were before us, and so many. But again, you really need to follow up with clinics. Once you're discharged, and that is the problem, the error most of us parents make. You're discharged after induction, you're told to come after 2 weeks, you don't come. Right. You come back 2 months later after you realize the child is deteriorating. You need to follow up with clinics. You're not supposed to miss clinics. Some people will tell you, no, you need to see some pastor to pray for you, to heal you, and the pastor will come pray for you and tell you you're healed, and you refuse to go to Kenyatta. I would advise, as they continue praying for you, move to the hospital. Some will consult witch doctors, and we come from different backgrounds. But I would rather, as your relatives continue consulting whoever they are consulting, whether it is spiritual leaders or whatever witchcraft they do, please go to the hospital, listen to the doctors. Because if chemotherapy is what probably brought down the malignancy, why don't you believe it is still the one that will clear it completely? And if the same doctor who treated you tells you to come back, they have a reason. Probably it's not about your money. So I would encourage them to ensure they follow up clinics to the latter. Because for example, my son during induction, we tested for cancer, there were no cells. Completely, there were no cells. But I followed for clinics for 3 years. 3 years. I know it's strenuous financially, emotionally, in all ways. But you have to follow up with clinics.
Great advice. Thank you
Yes.
so much, Caroline, Sydney, and Dr. Mutua for
Thank you.
coming in and sharing more on this subject. We can't stop talking about it, certainly, and raising awareness and sharing your stories of victory and triumph. You can beat this. So thank you for your encouragement. Thanks for watching Citizen Weekend. I'm Victoria Rubediri. Have a lovely evening. I'll see you again tomorrow night on Sunday Live with Jeff Koinange.